Hello, and good morning. It's morning for me, at least. This is Representative Eric Redmond's February 15th, the 20th Fireside Chat. However, today it's the kitchen table chat. Psalm 125, verse 2 and 5, verse 11 to 12. Those who trust in the Lord are like Mount Zion, which cannot be moved, but abides forever. As the mountains surround Jerusalem, so the Lord surrounds his people from this time forth and forever. But let all those rejoice who put their trust in you, Lord. Let them shout for joy, because you, O Lord, defend them. Let those also who love your name be joyful in you, for you, O Lord, will bless the righteous. With favor you will surround them as with a shield. I have got 4 bills I am co-sponsoring. First one, House Bill 89, brought to the House by Second Amendment Alliance, President Greg Pruitt. It's a constitutional carry bill. Heather Scott is the primary sponsor, although the bill is presently being held in the State Affairs Committee. As a co-sponsor, I was at the rally, and Channel 7, a Boise TV station here, interviewed me at that rally. I was in Boise on Saturday. The U.S. Constitution in the Second Amendment states, "The right of the people to keep and bear arms shall not be infringed." We have the right in Idaho to open carry a firearm already, but we have to pay and take training to carry concealed weapons. There are 5 states in the U.S. that require no license or permit to carry a concealed firearm. Actually, 18 other states have bills at this time to do the same. Idaho should join the 5 this session. And again, if traveling to other states, you may still need a permit approved in those other states. House Bill 154, formerly House Bill 88, that requires a physician to have physical presence when performing a chemical abortion. This is to stop the webcam telehealth physician chemical abortions that Planned Parenthood is promoting. Since in Idaho they have a very small presence, I believe only in Boise. It is sad enough that the Obamacare mandates now allow abortion coverage on individual health insurance plans. This legislation is sponsored by Right to Life Idaho, Idaho Chooses Life, and Cornerstone Family Institute. I told Carrie Umlenkotnot, sorry, the last name is a pronouncer. Anyway, I told Carrie of Right to Life Idaho I would be on board as a co-sponsor. 17 other states have passed this common sense legislation. Another bill I am co-sponsoring is House Bill 108, which allows opioid antagonistics to be purchased by anyone at the pharmacy. Christy Perry is the main sponsor. This drug will bring a person experiencing overdose symptoms back to near normal for 20 to 30 minutes when 911 can be called. Repeat doses can be given for additional time. This drug can be given by a syringe or even through an inhaler. The American Medical Association and the Idaho Board of Pharmacy are okay with this drug sold to any adult. There was testimony by several mothers who had a child die from overdose, and this would have given them time to call 911 and get physician help to save their children. The police departments and EMTs normally have this drug. If this drug is given to anyone not in overdose condition, it has absolutely no effect on them. It works on the opium type overdoses, which includes many pain, depressant prescription drugs. It does not work, however, on meth overdoses. The 4th bill I am co-sponsoring is the bill sponsored by Luke Malek that I had actually moved the motion to go to the House with a do pass vote. It is an expanded service by the Emergency Medical Services. Ada County EMTs are presently addressing health care gaps and best patient outcomes in Ada County's 24,000 incidences of 2014, there was only 5% that were transported with lights on, 61% without lights transported, and 34% did not even go to the hospital. Instead of just going out on emergency runs, EMTs become community paramedics with extra training and the addition of physician assistants to their staff. Another one of their duties would be in like a 30-day follow-ups of post-discharge hospital patients. For example, a senior discharged from a hospital after a heart attack, the EMT visits the patient in their home where they are more relaxed and receptive to ensure that they are taking their blood thinner pills at the right time. This actually will help decrease readmission to the hospital and those costs. One other bill I will sponsor is a bill allowing Kootenai Health to invest their idle funds in A-rated bonds, the same as the Idaho State Treasurer can do. In 2008, in that time period, they lost money on investments because they were limited where they could invest. Kootenai Hospital has not taxed the Kootenai County residents for 10 or more years and are continuing to add to their coverages along with building more hospital wings, and their goal is to be an Idaho 10-county regional hospital. Other bills that were acted on this week was one of them was a telehealth bill, which helps especially in the rural areas, which we have many. For example, Clark County has less than 900 persons living in it, in the whole county. There are 3 other counties with less than 3,000 persons living in them. This will allow a rural primary care physician to undergo procedures by webcam from a specialist, or finding out the best prescription drug for a certain ailment. We actually have a rural physician training program undergo with special funds, not coming from the state. These special funds aid the interns in paying for their physician training. One other I met with was administrators of skilled nursing and assisted living facilities from the Idaho Healthcare Association. I was able to coordinate discussions between the administrator by the name of Brad of Valley View and his assisted living facility in St. Mary's. They have one in Monters Ferry too, with the Department of Health and Welfare regarding some very punitive and heavy-handed surveys they did on his facility to see if maybe a more educational survey can be set up. Because of follow-up surveys, when a complaint is sent to Health and Welfare, the department is 250 surveys behind. Another House bill that was passed that will help slightly the transportation funding crisis that we are in is a bill to exempt taxing the 6% sales tax on road materials used to maintain public roads of the state, local, and cities. The contractor providing that material to these public entities should never have been taxed to begin with. This will provide a potential decrease in road maintenance costs of $20 million. There was another water adjudication special meeting where the North Idaho legislators were given a folder of the coming court cases. The Coeur d'Alene Spokane River Basin adjudication with the presiding judge Eric J. Wildman set up the court scheduling order on February 12th. The next court date is April 15th, 2015, with multiple other dates ending on April 3rd, 2017. Yes, 2017, with the trial on the entitlements. Senators Mike Crapo and Jim Risch came to the Capitol in our House chamber and gave less than encouraging speeches. They were good speeches, but they were not the positive type speeches we'd like to hear. Senator Risch agreed the sovereignty 10th Amendment of the states is in true crisis by the U.S. Congress. Because of the U.S. Congress, the abuse from the federal agencies is 21,000 new rules in the Federal Register and 481,000 of pages at a cost to the private sector of $785 million per day for these new regulations. They now spend, the federal government, $11 billion per day and borrow $2 billion per day